Welcome to our executive interview series at Cyber Talks presented by CyberScoop. I'm Wyatt Cash, and we're here with Charlee Hess, Director of the Healthcare and Public Health Cybersecurity Division within the Department of Health and Human Services Administration for Strategic Preparedness and Response. Charlee, thank you very much for joining us.
Thanks for having me.
I'd like to start by asking, looking at the current threat landscape, which specific vulnerabilities or attack vectors are most concerned to you, particularly relative to critical infrastructure? And can you talk a little about what countermeasures you're prioritizing as a result?
Sure. So I work with the healthcare and public health sector, one of the 16 critical infrastructure sectors. We're the sector risk management agency. So we are trying to build that resilience, that cyber resilience across the sector. And the threat vector we see the most is ransomware. That has been kind of a big issue in our sector. We are relentlessly targeted. Our sector has very valuable data. All of that personal health information that you don't want public is what they're after, so they can try and extort some good ransom payments out of it. We also have life or death organizations and critical functions in our sector. So if you think about hospitals and blood banks and pharmaceuticals, all of those things are really important. And so it creates a lot of noise and attention when they're hit by ransomware. Again, making it more attractive for those bad actors. Those criminals are out there after the money, and the bigger disruption they can produce, the more money they feel like they can get. So we are focused on a couple of things to try to counteract that. One is, those good cyber hygiene practices on the front end. If you can avoid the attack to begin with and not allow it to happen, that's the best scenario as opposed to needing to respond. So we've released healthcare and public health cybersecurity performance goals, which are separated into essential and enhanced goals. So those are more basic and more sophisticated. So if you think about your single providers or your less resourced organizations, they can really start with those more basic goals and do those things to help bolster their cybersecurity. But they can follow those as a roadmap all the way up through those more sophisticated goals and the bigger organizations, and it really tells them what they need to do to bolster their cybersecurity, kind of taking bite-sized pieces.
Terrific. And then as the cyber workforce gap grows, particularly in government, what innovative approaches are you seeing to invest in and build the talent pipeline?
Yeah, so the talent pipeline is really important, and coming up with innovative approaches to fulfill that gap in subject matter expertise. We talk a lot about those smaller providers that probably don't have a cybersecurity professional on staff, or they don't have many. Sometimes it's the secretary or the administration staff kind of doing it as a side job, and it's not their main role. So we have a couple of things we talk to our sector about. One is shared services. The more we can get collective and come together and share some of those costs and those resources. Maybe you can't afford a whole cybersecurity staff person, but you can get with your partners in your region or some kind of coalition to really share those services and build on that expertise. Another idea that we've seen and we're working with industry on is almost an exchange program. How do we get the more resourced organizations to kind of share their expertise with the less resourced organizations, or in rural health, right? We see a lot of gaps in rural health. They don't have a lot of backups because they're rural. And so we want to make sure that we are helping them access that subject matter expertise from the other areas in the more resourced organizations. So we're working with industry on tackling that. And then, of course, we want to be working with kind of the education system and internships to kind of show our up-and-coming cybersecurity professionals that there's a role for them in healthcare too. I don't think cyber folks always think about healthcare, but once we start talking to them and they realize the importance and the just the dramatic impact that cybersecurity has on healthcare, there's a lot of motivation to get involved. So there's an education component to it as well.
That's such an important mission, and hopefully a great opportunity for a growing workforce as well.
Yes.
Well, Charlee Hess, thank you so much for joining us here at
Thank
Cyber
you.
Talks.
Thank you. I appreciate it.